It is National Immunization Awareness Month, and experts want you to know the steps that you can take to protect your health and the well-being of those around you. Joining us now is Dr. Greg Buller, Chair of Medicine at Bridgeport Hospital. Dr. Buller, it's great to have you with us today.
Thanks a lot. I appreciate being here.
Of course. Well, why is this awareness campaign so important?
Well, immunizations have really changed the health of individuals across the world since their discovery a number of years ago. The number of mostly children that died from completely preventable diseases by immunization is in the many, many thousands. So diseases such as smallpox, polio, they've been eradicated. We thought measles too had been eradicated basically from the face of the earth, or at least from the United States, due to immunizations. And now, especially going into the school year, it's always good to kind of rethink: have my kids had their immunizations? And of course, thinking about adults too. There are some immunizations that adults usually don't think of, that they're really necessary.
What are some common misconceptions about vaccines? We hear about people doubting their efficacy. What would you say?
Well, they're incredibly efficacious. That I don't think is a matter of any kind of discussion, or at least it should never be. They are incredibly effective at preventing whatever they're supposed to prevent. I mean, we can certainly just leap to the most contentious, which is COVID. Incredibly effective. It saved countless number of lives across the world. But the concern, of course, are the potential side effects. And everything has potential side effects, but the side effects from immunizations are very few and far between.
Connecticut ranks among the top states in the country for vaccination rates, which is a great thing. What vaccines are recommended for kids, and you touched upon this, before heading to school, because we're right in that back to school time?
Right. So kids who are going back to school, they get 5 doses over the course of from when they're born to when they're about 4 to 6 years old of a diphtheria, a tetanus, and pertussis vaccine. So that last dose is probably worthwhile doing before they get into school. This is in the 4 to 6 range. They should have received a polio vaccine, the last of their series of polio vaccines. They should have received their second so-called MMR, measles, mumps, and rubella vaccine. They should have received their second chickenpox vaccine. All those for kids that are starting like in kindergarten. Then as kids get older, they need boosters like the Tdap, again, tetanus, diphtheria, pertussis vaccine. And then probably worthwhile considering a meningococcal vaccine as well, which prevents meningitis.
Dr. Greg Buller, great advice, Chair of Medicine at Bridgeport Hospital. We really appreciate your time and expertise today.
Of course, great being on. Thanks.
Thank you.